get on to the good stuff. That's all the pathology behind the way, and I thought, you need to know that. So now get on to the work that I do. So I had to train myself in that to give you a good idea of my work that I do. Shoemaker's research has showed the diagnosis is based on assessment of the home. This is where I come in. ERMI, Environmental Relative Mould Index, was developed by the US EPA, and what it is a collection of dust sample, just taking a dust sample and checking for over 200 microorganisms within the dust. It is one of the most effective ways to determine mould, fungi and bacteria. Because we know it's not one fungi that's causing the illness, we know it's a chemical stew of bacteria, fungi and all their byproducts. So ERMI gives us a mechanism to test the DNA. It's using polymerase chain reaction DNA sampling, and basically it's DNA sampling everything in that dust. And then because they've checked over 2,000 homes in the States that are healthy, they can then use it as a sliding scale to go, this is a healthy home versus a sick home. The down marker on this is that it's expensive. It's $300 per sample, and you need to do 2 for a house. You need to do the bedroom and the living room. The other downside is that as a building biologist, seeing if mould is a problem is that I need to identify, first, is mould an issue with this home, and secondly, where's the water coming from? And I have to use a variety of tools to assess that. Thermal imaging cameras, ATP testers, moisture meters, hygrometers, indoor air quality units, because it could be due to humidity levels or condensation. It could be due to just a flood. And so there, it gets quite complicated what we need to do, and I'll give you a bit of an explanation on that. Excluding all pathology tests. Most of you know, people with chronic fatigue, nothing comes up on the pathology test. Full blood examination, nothing. It's because we're not looking for the inflammatory markers, and that's where it's sort of bypassed us for so long. Visual contrast sensitivity test. Gee, am I excited about this test. Used and developed by the US military. It is a brilliant test to check for damage to the central nervous system as a result of multiple chemicals, i.e. chemical sensitivity, and due to biotoxins. And in fact is used by the Centre for Disease Control in the US to check for biotoxin damage. It's free. It takes 5 minutes on the internet to do, and the results I'm getting from this test are remarkable. So before I go to a patient's home who's sick with chronic fatigue, I get them to do the test to see if biotoxins are an issue. Now, this checks for biotoxin damage due to the inflammation based on what I've just talked about. It doesn't look at biotoxin illnesses due to an IgE-mediated response, which you'll pick up on a RAS test. Okay? So I'll summarise. Fungi can affect people in different ways. It can affect them through an IgE-mediated response, but it can also affect them from a chronic inflammatory response, which is what I've focused on in this lecture. Visual contrast sensitivity looks at the way in which grey lines go to the side, where they go to this side, up and down this side. And it doesn't involve how good you are at seeing things. So wearing your glasses, if you wear it at a certain distance from the computer, you then determine and click, is the lines going to the left, to the right, upside down, etc. And you click the button. And that's it, pretty much. You go a whole lot of tests to check for visual contrast. And they've found that damaged biotoxins and chemicals affect the optic nerve as a reflection of the damage in the central nervous system. So they're finding this a very useful test. It's not a test to use to diagnose patients, but it's another biomarker we can use to determine if biotoxins are affecting patients' illnesses. The biomarkers that Shoemaker primarily uses are low VIP, vasoactive intestinal polypeptide, melanocyte-stimulating hormone, antidiuretic hormone, and VEGF, and high levels of TGF-beta1 and C4a. VCS has been used since the 1980s to determine the impact of chemicals on neurological function. So here is an example here, as you can see, of the test of different people. I'll go into an example. In fact, I've got results of a patient of mine who has gone through this whole procedure, and I'll show you. I'll use her as a case study, unless I run out of time, which is very likely. VCS test provides a quick, non-invasive and inexpensive tool for assisting in the diagnosis of biotoxin and chemical-related illnesses. In the scientific literature, VCS has been used for people with multiple chemical sensitivity. It's free. Takes you 5 minutes. It's brilliant as one of the biomarkers to determine MCS and also biotoxin and mould-related illness. Deficits in VCS associated with chronic organic solvent exposure have been documented in the scientific literature. So you can see there's one of the references, and biotoxin-induced neurological defects. A peer review on the state of the science concerning Pfiesteria, which is a dinoflagellate that causes biotoxin illness. This is the one that Schumacher first got involved with because of the algae growing in the estuaries along the eastern seaboard of North America. The US Centre for Disease Control concluded that VCS can be used to indicate neurological changes in patients exposed to Pfiesteria, which is a biotoxin. Visual contrast sensitivity is used in conditions that affect your ability to discern. So these are the biomarkers that Schumacher is using for people with this inflammation. Low VIP, low MSH, high TGF, etc. High nasopharyngeal swab to check for Marcons, which I mentioned. This is the reason why many of his patients didn't get better, because there were staph bacteria sitting there creating toxins that are setting up this inflammatory cascade of events in the central nervous system. Genetic testing, unfortunately, it's still really expensive, but for whatever reason, he's been able to test because they get insurance. They can claim it off their insurance in the States for genetic testing. I don't know what it's like here, but because of all the tests he's done on his 12,000 patients, he's identified this gene on chromosome 6, which makes these people susceptible to this systemic inflammation. Ironically, the same gene is used to identify possible organ rejection after a transplant. Another method of biomarkers that he uses is magnetic resonance imaging to determine specific brain structure volumes, gliotic areas, atrophy of the caudate nucleus, and enlargement of the pallidum, left amygdala, and right forebrain. Magnetic resonance spectroscopy is also a biomarker that he's using because of increased levels of lactic acid. The lactic acids, of course, is occurring because the cytokines that are occurring in the capillaries are restricting oxygen and building up lactic acid within the brain and in the periphery. So he's finding that there's a change in the glutamate-glutamine ratio within the central nervous system. So that's the end of the pathology side of things. I want to go into mould remediation. So what do you do when there's mould in the house? Well, I have to say this is probably one of the most common causes of illnesses that is not being recognised by natural therapists, doctors, or even by the government. Mould has been with us since the planet was born. It is the most remarkable species to be able to adapt to any environment. So if you give it food and water, it's going to survive because it's everywhere. So water is the key, and part of an important questionnaire for you to ask is, how long have you been living in the house? How long have you had the symptoms? Has there been any signs of flooding or water coming into the building? Are there drainage issues around the house, etc.? Are you in a flood zone? All of these things are important. Why councils allow people to build in flood zones like Brisbane completely defies me. First, identify the moisture. If you don't get to the source of moisture, then the client's going to continually be sick. And all of the research from the US on this has found that giving cholestyramine and going through all of the nutritional supplements and getting rid of the Marcons is useless if you don't get to the mould. If they continue to live in a water-damaged building, nothing will change. Containment. This is how they contain. Now, you can see here, this is a really bad mould-infested house. I have to say, the worst mould homes I've ever seen, I couldn't smell mould and I couldn't see it. And I walked in there without my full-face respirator, took the case history, and this is typically how it goes. I'm really sick. I don't know what's going on. I've got chronic fatigue. I've been to every practitioner under the sun. I'm now going to the States to get treatment because no one can help me in Australia, but my husband's fine. He goes, I don't know what's wrong with her. He's almost implying, I think she's got a mental illness because there's nothing wrong with me. Yeah. Interesting thing. I'll go through this case study because that's exactly what happened. How do we address mould? We contain it. Wherever the moisture is, we contain it. We then use negative air pressure so it doesn't continue to contaminate the rest of the house. We remove the contaminated materials, we clean the surfaces, and then we do post-sampling. Apart from high humidity, in tropical climate zones, the majority of water problems in a house are due to condensation. Why? Because the ventilation is inadequate in our laundries and in our bathrooms. Who on earth would allow condensation to get in the roof cavity? Once it hits the dew point, it condenses, and then all the microbes sitting there in the bats, etc., and on the roof are starting to have a field day. We need to make sure the humidity from our showers is vented to the exterior so it doesn't create this condensation issue, which is a real problem. So I ask my patients, do you get condensation forming on your mirrors or walls when you have a bath or when you have a shower? Because that should not happen. The ventilation is not adequate. And the more we've sealed our homes, the more of a problem this has. So I give lectures to Archi Centre and to the Building Design Association, and they're horrified when I talk because I'm talking about how green does not equal healthy. In fact, green can actually make patients a hell of a lot worse. Why? Because you seal the building, you bring in Chinese mattresses that are loaded with formaldehyde, and they take forever to outgas because, no one in NICNAS isn't assessing and regulating the chemicals in those products. But that's another lecture altogether. Food, water and spores equal mould growth. Where's the food? Everywhere. Where are the spores? Everywhere. So water is the key to mould-related problems. Plumbing, gutter issues, roof issues, inadequate ventilation in wet areas, inadequate absence of waterproofing, amount of dodgy builders that don't waterproof the shower recesses adequately, inadequate drainage around the building. Why would you build a house at the bottom of a hill? Think about the topography, really have to think about if you've got patients with illnesses, and a lot of the clients I deal with kids with allergies, I'll go in and inspect before they buy the house, and I go, this is not appropriate for your child with asthma. These are all the water damage issues that can occur in this particular house, let alone being near a lake that could have algae issues down the track. Land topography, flood zone, natural aquifers under the house. Housekeeping issues, sometimes it's the occupants. You've got too many people. I've gone into homes in Williamstown where you've got an entire Indian family and all their set 2 generations in a 1-bedroom apartment, and they're breathing out a hell of a lot of water vapour that's causing condensation issues. This can be a real problem. How we dry our clothes, where does the humidity go? You've got to be careful about drying your clothes and your dryer, etc. It needs to be vented to the exterior. Aftermath of a fire, natural storms. This is an important one because what you see here is that the relative humidity levels, at 50% relative humidity, most microbes cannot survive very well. So if you have asthma or allergies, keeping 50% humidity in the built environment at the home can significantly reduce their exposure to microorganisms, because anything above 50% humidity enables bacteria, viruses, fungi and house dust mites to thrive. So this is why, in high tropical climate zones, as we go further north, it's important to have dehumidifiers or refrigerative air conditioners to dehumidify down to 50%. Get them to get a hygrometer, they're cheap from Radio Shack, in their house, and try and keep 50% humidity, and you'll find that the asthma levels and asthma attacks are significantly decreased because of this. 1 square inch of visible mould is likely to contain in excess of 500 billion spores. So if you can see it, it's already a problem. The problem with mould, how do you clean it? You don't, because mould, whether it's viable or not viable, it contains mycotoxins. So all this thing about bleach is the worst thing you can do for mould because you give it a food source. You strip the melon out of it, so you bleach the mould, but within 2 weeks it comes back because it never went, and now you've given it a food source. You don't need biocides. In fact, you'll find that the ICRC, who are the major, most reputable organisation of mould remediation in the world, they're based in the States. I just came back from the States doing my ICRC, and they state, don't use biocides on mould. Don't use any chemicals on mould because it's dead anyway. Killing the mould is irrelevant because whether it's dead or alive, it still contains mycotoxins and other toxins that can make you sick. So contain and negative air, this is what a mould remediator will contain the area that's affected by mould. There's 3 ways. They then bring in dehumidifiers because they're going to get air scrubbers and air movers to get the moisture out of the building materials. The moisture gets into the air and then the dehumidifier will exhaust that into the exterior. If you don't do dehumidifiers, what's going to happen is these air scrubbers are going to get the moisture out of the wood, and then the moisture goes into the air and then starts penetrating into the gyprock and into the ceiling. So you have to have dehumidifiers to get rid of the moisture. Then you remove contaminated material. A lot of material can be salvaged, but a lot can't. If it's in gyprock, it's a problem. We have different category 1, 2, 3 and class 1, 2, 3 as to whether we can remove it or not, depending on the extent of the water damage. Biocides are not recommended, as I mentioned, because unless extensive sewage contamination has occurred. They are the major authorities on this. How do we get rid of mould? We physically remove it with microfiber cloths. Microfiber cloths are the most important way to remove it, because when it comes to microorganisms, it's a numbers game. Reduce their numbers. We use HEPA vacuum cleaners. Now, I'm saying that you need to get a proper mould remediator who's certified through the ICRC to get mould out of the house. Because if you get a Mickey Mouse carpet cleaner coming to clean your patient's mould, you're going to spread it and cause secondary damage throughout the whole house. So there are links on my website to accredited mould remediators that will be useful. So these are the measurements I use, etc. But you know, the best stuff is yet to come. Let's quickly do the case study. I'm sorry, I'm really rushing for time here, but we do have half an hour at the end to ask questions. 54-year-old female presents with chronic fatigue. She has a history of antibiotic use and spastic bowel and gut dysbiosis is bad. Tonsillitis, hay fever, headaches, candida. She's lived in a water-damaged building since her childhood home. Then in Chadstone for 10 years, headaches and migraines, joint pains. She moved to Blackburn, ongoing plumbing and drainage issues, muscular aches and pains, fatigue, sleep disturbances, weight loss, diet problems. She worked at the Freemasons in an old section that was water damaged, just to top it off. In her 50s, she has ongoing chronic fatigue. She's seen everybody about it. She now goes to the States to get treatments. Amalgam removal, as we know, tends to exacerbate most patients with CFS because of mercury vapour exposure. Severe reaction, she's getting worse. I went to her house to have a look what's going on. No visible mould, no detectable damp or musty odour. All my moisture readings were normal, they were dry. Visual inspection showed cracking in the exterior garden, red brick wall, and moisture readings in the brick wall were high because of the fact that the garden beds had been put onto the brick wall and the moisture from the soil was getting into that area. Visual inspection underneath indicates staining and mould on the bearers under the bathroom because of previous water damage. ATP readings, which is a really great way to test, checks up the ATP in the mitochondria of the microorganisms. So it's a cheap way for us to check for microbes in various parts of the house without having to do air samples, which are expensive. Hot water overflow pipe drips into the soil, water and into the subfloor, and the down pipe is leaking into the subfloor as well. And as a result of this, the concrete slab was sinking into the soil because of the amount of water damage. Can't see it well, there's a lot of rusting here, a lot of slow water drip that's occurred for decades in this area getting into the subfloor. Significant dust issue. When I removed the registers and looked into her ducted heating, I went, oh my God. I don't say that in front of my clients, of course, but I'm going, you know, I mean, I think it's normal. You get your vacuum cleaner and you clean out your ducts, but obviously a lot of people don't. She's been there for, 15 years, and this is where all the mould samples, the mould contamination was occurring because the flexible duct in the subfloor had breaks in it, and of course once you get water in the subfloor, when you draw the heating, of course it draws in through the flexible duct into the return air and it floods the entire house with with spores and high sample counts. Vinyl flooring. Vinyl is the worst. For those who are coming to tomorrow's Women's Health Lecture, I'm talking on endocrine disrupting chemicals, and vinyl would be the worst building material we could bring into our house because of the phthalate exposure and the risk to breast cancer, early puberty, etc. Vinyl contains phthalates, which are known endocrine disrupting chemicals, and it's also a waterproof membrane, so it's a disaster for water issues because any water in the subfloor that's coming up, it's acting as a water break and therefore creating more issues in the subfloor. These were the results of this woman. It's house. Remember, he is not sick. She is so sick. She said, I know within hours of being in my house, I'm so sick, I can no longer live there. They're living in a rental house around the corner because she can no longer live in her house in Blackburn. And the mould counts were 32,200 per metre cubed of air. Outside was 8,000. They were 32,000 in the master bedroom. And it was all coming from her, from the subfloor, because there were breaks in the flexible duct, allowing it to come in through the whole heating system and affecting the entire house, but particularly the master bedroom. She said, well, that's interesting because I always find the master bedroom I can't sleep in, so I've been sleeping in the living room for the last 3 months because I can't sleep in the bedroom because I get so sick. And it confirmed. He doesn't get sick. Why? He doesn't have this DNA that I was talking about, this genotype, which affects 24% of the population. So her tests were normal. I then got her to do all the tests that Shoemaker recommends. I've got the results of her test. Nutripath in the last 2 months are now doing these tests. So these tests have not been available in Australia that I'm aware of beforehand, but Nutripath now are doing these tests for all these inflammatory biomarkers in the last 2 months. We did these tests after she was normal, and in fact her visual contrast sensitivity within 3 months of moving out of her house, her visual contrast test went from positive to negative. So it was a really good marker to determine that she was getting better. She said, I feel better. The VCS test is now negative. And when we did these tests when she was much better, because she's no longer living in her house for the last 3 months, these are the tests that these are all her tests, and we've just run out of time. So immunoserology, etc., blood stool tests, Nutripath, these are all the tests that she got. She didn't come up as high in terms of inflammation because she was 90% better because she'd been out of her house for the last 3 months. What she said that instigated her to pick up the phone and get me in to test her house was, she said, of all the things I've done, like I get intravenous glutathione, I've been to the States, I've spent tens of thousands of dollars on treatment, but the thing that helps most is when I don't live in my house, and that's why I needed you to come to check. I think it's in my head because my husband Pete, who smokes like a chimney, doesn't get anything. And lo and behold, when we looked at those air samples results, they were off the rack. We could no longer go in that house without a full face and Tyvek suit. That's how contaminated that house was. But you couldn't see the mould and you couldn't smell it. So are these diseases actually a chronic inflammatory response? Are we going to see in time that what we thought was chronic fatigue as a misdiagnosis is actually a chronic inflammatory response syndrome, where chronic fatigue syndrome, multiple chemical sensitivity, mould illness, maybe even electromagnetic hypersensitivity, fibromyalgia, could these actually be inflammatory disorders that we have not been looking at in the right place for the biomarkers? So I'm a building biologist. I wrote the book Healthy Home, Healthy Family, which is on the Optimum website. Thank you very much. The book and I'm also CEO of the Australian College of Environmental Studies, so I train people to become building biologists, to walk into buildings and to see if the house is making their family sick. I run nationally accredited training. It's currently a Cert 4, and I'm developing an advanced diploma in building biology because we just don't have enough people to do the work. And we get a lot of calls from people who are sick who, at the last resort, want to see if their house is making them sick. So this is what we do. We liaise with doctors and mould remediators, electricians, plumbers, sparkies. We're talking to a lot of tradespeople about how to wire a house to reduce people's exposure to EMFs, how to, create drainage, more adequate drainage. We work with engineers, etc. We work with lots of different people, which makes my job very interesting. That's my book, which you probably have seen, and there are all the references. I did finish, and I think I've got a couple of minutes left, or not.
Fantastic, Nicole. Thank you very much, and a huge amount of information you covered in a remarkably short time. And I'm sure our heads are spinning a little bit. Who would like to start the question? We'll go around the room. How about that?
Oh, thanks for the picture.
Thank you, Nicole. That was a fantastic presentation. I learned so much. I have a couple of questions. One, what is that Nutripath test panel called?
Yes, I don't know, but it's the only one of its kind on their website, so I'll give you that to have a look through. Yep.
Thank you. And then which HLA haplotype do you have to test for?
DR.
It's just called DR.
Yeah, that
There's
I'm aware of.
no number.
Not that I'm aware of. You'd need to look at Shoemaker's website, biotoxin.org. But if you Google Richie Shoemaker, there's actually an 11-step protocol for GPs. I believe Tanya Ash and there's a doctor in Queensland are the only 2 GPs that are following this protocol at the moment. And he has an 11-step protocol specific for GPs that you can... That's not familiar. He has an Indian name. He's in Queensland. And he's been following a lot of this work as well. So Tanya is the one who I send my clients to at the moment, but I like to be able to send all my interstate clients to you guys to be able to help them identify why they're sick.
And a quick third question. Why do people get more susceptible to having electric shocks when they have more water in their body? Is it just
it's the sodium levels because the decrease in water, it's the osmolality issues that they have. So because of the decrease in the water, they have higher levels of sodium, and because of the increase in electrolytes, they're more susceptible to the electric shocks.
Thank you.
Moving around.
Matthew Strack from Dunedin, New Zealand. Thank you for a very interesting and passionate talk. I enjoyed it very much. You talk about HLA and the haplotypes we test for people with gluten sensitivity are 2.2, 2.5 and 8, and you're talking about 6 for people with this type of sensitivity. It doesn't seem that they're overlapping.
I couldn't comment on that.
Yeah, okay.
You'd need to look at Shoemaker's research in terms of into that, because I don't do the pathology testing. No.
Because I just think that was a fascinating concept you brought up. Second thing, at one point you said something about systemic inflammation affected probiotics. Could you explain that a little more?
Yeah, it was more in terms of the way in which the microorganisms which continue to survive in clients who have this genotype, that it can actually affect when they're actually swallowing the sputum in children, for example, or when it's getting into the intestines through the bile, that the bacteria on their process of the way of getting excreted can actually be exposing and affecting the dysbiosis within the gut, so affecting the probiotics that are naturally within the gut.
Okay.
Yeah.
And just finally a comment, I grew up next to a river, so I'm rethinking parts of my otherwise fairly happy childhood.
This table?
G'day, I'm a GP in a subtropical town that turns black in summer. So, rural town, what's an assessment cost? How do people in rural areas get somebody to assess? Or alternatively, what does it cost to actually do a Cert 4 so that local people can be trained?
Yes, good questions. We have 15 building biologists currently, 20 building biologists who are currently graduated. At least half of them did it out of interest because they have kids on the spectrum or have allergies or chemical sensitivity and live in remote areas because they're quite sick. So we have very few around Australia. We have approximately 5 working in Melbourne and 2 in Sydney at the moment, but in remote areas we don't have many people to do it, unfortunately. The Cert 4 consists of 8 subjects. It's a 1-year full-time course and it is currently $6,500 to do, and you pay as you go per subject. It is Austudy accredited, but it depends if you're eligible for Austudy through Centrelink. Yep. As I said, I'm currently developing the advanced diploma, which will be an extra year to that, and I'll focus more on children's environmental health and EDCs particularly. And also on mould testing. So a lot of the work that I'm doing, because there's no methodology to do mould testing, and that was part of the reason I went to the States recently, is I'm developing a methodology to be able to make sure that all my graduates are consistent in their ability to identify moisture intrusion in a building, because at the moment it's a dog's breakfast. I speak a lot at the mould remediation conferences, and they don't connect the illness with the mould. They just see there's a flood, we just need to clean it, etc., and don't have an understanding of the illnesses that can occur in their patient or in their clients' homes. So I'm trying to map and get you connected with the mould remediators, accredited mould remediators, who can do the work and actually remediate. But building biologists are the ones who test, so often we'll go in and they'll say, look, I've got chronic fatigue, I think my house is making me sick because it's happened since I've been here. We have to exclude electromagnetic fields, we have to exclude mould. They are the two big triggers first. And when it comes to insomnia, they are also, EMFs are the big trigger for a lot of those symptoms. So the symptoms, I train my building biologists to go, these are the symptoms and these are the hazards likely to affect these symptoms, and you need to exclude those. Sometimes, rarely, 5% of times when I'm doing an audit, I'll find the house isn't making them sick, and I'll say, look, you need to go and see an integrated GP or naturopath because it's not related to your house. And that's nice to do that. Mind you, they've just spent $400 for my advice, but you know, it's rare. It's rare. But we need to get more people to work building biologists with you guys, but there's so few people doing the work.
So $400 for an assessment?
I charge $400 for an assessment, yep. It takes about 3 hours.
That's actually less than I expected, so.
Yeah. That doesn't include mould samples. To do mould samples, they're $75 per plate with the lab. Yeah. So it can get to $1,000 for mould sampling because it's simply the lab costs. You have to do one outside as a benchmark for what's happening inside because that's what you're comparing it to.
And that's was 1 year?
1 year full-time, 2 years part-time. Distance?
Distance.
You have to come to Melbourne to do a 7-day intensive. So we need to show you what to do.
Tim, I did ask before, where do you get the spartane-free cholestyramine? It costs $1,000 a month to compound it here, I believe.
Yeah, I think I'm afraid you do need a compounder, really. That's the problem. I can talk to you about it later.
And what do you think about earthing mats for EMF?
Ooh, I'm going to talk about EMFs towards the end of today, so can we talk about that then?
Very interesting lecture, Nicole. Thank you very much. I'm an environmental health researcher, and my investigations, my studies into this area clearly points to a chronic inflammatory response to be behind a lot of the chronic immune, neurological or endocrine disorders we are seeing on the rise at present. But in terms of, of course, the mold issue is an issue in a lot of homes. In affected individuals. However, when I look at the scientific literature into electromagnetic hypersensitivity and what you have presented, it is a real chicken and egg situation. What is down? I think this sensitivity to fungal toxins is a downstream process. My findings point to electromagnetic radiation as a trigger, like a trigger of chronic stress responses in the body, and as a result, individuals may become more sensitive to a range of like ordinary proteins. It could be all sorts of allergies and like more autoimmune processes. So it's a challenge, but you're on the right path. It's obviously the inflammatory cascade is very important to study, and determining which fits where is the challenge.
And that's a difficult one to answer because, with EMFs we're all exposed. Most of us have mobile phones. We know electromagnetic fields increases the permeability of the blood-brain barrier. So if you have a patient with mould using a mobile phone, increases the permeability of the blood-brain barrier, all these biotoxins are getting in quicker. I think what we all acknowledge is that chronic illnesses involve multiple causes. They are not a one-stop, what this causes this, etc. We need to look at the entire patient's history, their diet, their lifestyle, etc. And EMFs is certainly an issue that we're all exposed to, whether we want to or not, because the amount of, cell towers, Adelaide has just become using wireland across its entire capital city. It's just, we can't get away from it, which really represents an interesting thing for a dilemma for the scientific community, because how do you have a control group? But let me leave that one to this afternoon when I talk about EMFs.
Hi, I'm Lindy Paul. I'm a GP from the Adelaide Hills, kind of Mould Central, I think. It's pretty damp up there at the moment. But I was wondering, I've got a couple of patients, you mentioned dizziness, and got a couple of patients with Meniere type things, not totally diagnosed. And is the basis for that the whole osmolality thing, the sodium concentration, do you think?
They suspect that it could be due to the impact on melanocyte-stimulating hormone as the neuropeptide. What I have found, though, is a lot of clients who are exposed to high levels of radio frequencies have Meniere's and vertigo, who respond by getting out of that situation. So that's only from my own clinical observations, that they've developed it. Like, I had a husband and wife who moved into a house in Northcote in Melbourne, and within 6 months she developed Meniere's, and 3 months later her husband did, which is really odd. When I went to do the audit, their bedroom, which is windows on 3 sides, and windows are important in terms of radio frequencies because it can get through windows. It just travels through radio waves. I could see 5 mobile phone towers from their master bedroom, and I could measure them. The levels were excessive, and they found, I think it's an interesting coincidence that a couple developed Meniere's within 3 months of each other moving into this house, and have since moved away. And because hers was quite severe, she was on medication for that as well. His stopped moving out of the house, but she's continuing needing medication. But yeah, the house seems to have been contributing on some level. There's limited evidence on its relationship to Meniere's, but I think it's one we need to look out for and exclude.
So the mould issue is not such a big one?
For dizziness, yes it can. Mould is another one that can cause the dizziness as well, definitely. So ask the patient about water intrusion in the house, flooding, drainage, all that sort of stuff, important. And the thing is, you don't have to see it for it not to be a problem. The worst homes I've been in, I couldn't see it or smell it, and you literally would not be able to walk back in there without a Tyvek suit and a full face. Yeah.
One more question. Well, thank you very much indeed, Nicole. There are so many questions one can raise about some of the presentation and the information, but I'd like to draw attention to the diagram here, and down the left-hand corner it says that the pituitary gland can give rise to elevated levels of cortisol and ACTH. Cortisol is produced in the adrenal glands, not in the pituitary.
No, yeah, that's right. So
that
ACT
needs to be made clear.
Sure.
We all know from influenza infections that when the infection goes into the lower parenchyma of the lungs, that is followed by about 6 weeks of immune suppression. So TTH reactions become negative, and you get activation of things like herpes simplex and so on. So that's a very important aspect to this. But once the lower parenchyma is invaded by organisms, you can then experience suppression, or if you like, anergy, for up to 6 weeks. I'm told to keep this short, so I'm concerned about the complement cascade. I know a lot about complement and the emphasis upon C4. Complement can be activated by the alternate pathway or by the classical pathway. And what happens to the rest of the cascade? There are anaphytoxins there. C5a can activate certain cells and cause degranulation. What's happening there?
That's your question?
Yes.
In terms of the rest of the complement. Yes. In the research, in the scientific literature that Shoemaker has done, he has found that C4a is the most important marker, that C4b, etc., that the other complement has not been involved. Now, as I said, I'm not a GP and I don't do pathology tests, but I think what is a useful thing is for us to start looking at these inflammatory markers as a potential understanding as an inflammatory disorder. So I'd suggest that you look at his website in relation, because he goes into detail, and in fact even in the book, which I don't think I've mentioned, Surviving Mould is actually an excellent book which goes into the pathology behind the systemic inflammation that occurs, and there'll be a lot more detail there. Yep. Thank you.
Well, I think it's time to thank Nicole once again for a fabulous talk.